Welcome to PSYCHE. Today I'm going to talk to our school counselor about different questions regarding someone with depression.
People, they do use a statement or phrase that are not appropriate or not suitable for people who are struggling with mental illness, for example with depressions. One of the reasons that they use inappropriate statement is that they are not aware the impact that the statement have. Well, sometimes people do have good intentions actually when they say it, but then they are not realizing it actually that they have negative impact. So all these statements, what are the impact that they have for people who are suffering with mental illness is that they feel like they are not being heard. So for example, when a person say like, oh, you should try harder, just step out of it, and this is just a phase. So when people hear it, they feel like they are not being understood, and then they feel like the other persons, they are undermining or minimizing the struggles that they have. So they feel like what they are going through is not as significant. So in general, we ask like an icebreaker question first. So normally we ask question is because we notice something is different with this person. Maybe this person look a bit more quiet than usual, or you see this person is not eating well, you see your friends is not eating well. So then you can start off with the questions like, hey, I noticed that you have been a bit down recently, or oh, I noticed that you're quite quiet these few days, that you're not really mingle with us recently. So I wonder what is going on. So you start off from an intention with curiosity and concerns, show that you really care for the persons. So they feel like, oh, someone is willing to listen to me, to know what I'm going recently. Yeah, so that's the start off. And then after that, then see whether the person is willing to listen or not. So you can say, okay, you can always come and talk to me when you feel ready or when you want to talk about it. And can also offer help, like, so how can I help you? Yes. So when someone notice and approach asking questions to show that they care for you and they are there and willing to help you, so it creates a positive impact because, hey, this person actually really notice what's going on with me and is willing to take an additional steps to see what's going on, to ask me and offer help. So then the person will feel like someone cared for them and they are not on this journey alone. In general, when we notice or when we suspect people around us who may be struggling, then we will ask them like, do you think getting additional support is what you want? And we also can normalize it and say it's okay to get support, or it's normal to get support. And then you don't do it in a way like, oh, you just want to push it away, like you don't want to handle this person anymore, but you approach in a way that, okay, you should get professional support, and at the meantime, I will still be here together with you through that journey. Well, if people who are suffering with mental illness or depression, they have a faulty mindset on seeking professional help, then as a friend or as people, as the professional, then we have the responsibility to like educate them, to let them know actually it's not because something is wrong about you, and then getting professional support because that these people like counselors, psychologists or psychiatrists, they are trained professionally, that they know what is the effective interventions that can support them. So aside getting professional support, another thing that people with like mental struggles or like who are struggling, it will be good that they try their best to maintain their daily routine. So do their best, like for example, continue to school or to work, continue with socialize with friends, just to make sure as much as possible to maintain it so that it's not too derived from what they have done before. Yeah. Sometimes people with depressions, in general, not all, in general, some they do have a tendency to avoid socializations. Yeah, some is that they find it difficult to socialize with other people. Yeah, and some they still try hard. Yeah, I mean, if they can, they will still go for socialization, like meeting with friends and having dinners. Well, in general, based on research, it's good to have some amount of social life or social interactions. Well, when people with depression, there's no particular phrase, but there are some signs or symptoms that you can take note on. So when you realize this person recently makes some negative comments or perspective or thoughts about themselves or about the life or the world view, then maybe the friend or another person can approach and ask, hey, I noticed that recently you have more negative comments that you used to have, and then we can, from there, then you can see whether this person is struggling or not.
Thank you so much for watching our video and stay tuned for other videos.